Hi friends, as you might be knowing, almost 80 districts were locked down because of the coronavirus disease. Now, how to fight, how to see that all those who are going to suffer because of the coronavirus can be treated and can be saved. Just go and see the example of Wuhan city of China. Although it's a huge city with a large population, but still what they have done is that they have raised about 1,600 beds capacity immediately. And for that, 1,000 bedded hospitals were constructed within 10 days, fully equipped. Now in India, because coronavirus has spread in many districts, it's not possible to have one or two hospitals. Our existing hospitals are already overloaded by the patients of different diseases. So we have to come out with a solution to safeguard those patients also, those who are already suffering either from cancer, tuberculosis or any other diseases, as well as to treat these new coronavirus patients. I have a suggestion or solution to fight and to create more capacity of the hospitals or the number of beds. Today, the situation to create a new hospital or to construct a new hospital, it will take time. It's not that easy. So, how to do it? My ideas are the district minister along with the member of parliament, along with all the MLAs of that district, along with ex-ministers, ex-MLAs of the districts, as well as any other prominent opposition leader, plus the district collector or the deputy commissioner of the district, the police commissioner or the SSP or SP of that district, as well as the district medical officer or the civil surgeon of that district. They should form a committee. They should make a virtual meeting among themselves and form different committees of say 5, 6 people each. Now the first committee will talk to all the religious heads of the district, like temples, like mosques, churches, gurdwaras, Jain temples, etc., and urge them or request them to adopt existing hotels where the bed facilities along with the sanitation, the toilets and everything neat and clean are available. Because today, once the district is locked down, the occupancy is almost zero of all these hotels. Now but this to be adopted by those religious heads. So basically, whatsoever compensation or anything they have to be given, that will be given from the religious boards or religious trust without any expenditures of the government. That is the first committee which has to try and convince them as early as possible. The second committee will call and talk to all the medical colleges and as well as the good top hospitals, private hospitals, as their chairmen, the medical directors, to manage these hotels and lodges, resorts, dharmshalas, by sending their team of doctors as well as the nursing staff. Now, these medical doctors and the hospitals, the medical directors of the hospitals will see to it that whatsoever facilities they are providing at their hospital should not be compromised. The idea is that this coronavirus patients who are going to be admitted, they should be admitted in the new facilities, not in the existing hospitals. And existing hospital will treat all their patients whatsoever they are coming, whether it's a dental, ophthalmology or orthopedics, whatsoever patients they are catering, let them cater, but they should have an expert team of those who can treat the coronavirus along with the management of the coronavirus to these newly procured facilities of hotels, resorts, dharmshalas, lodges as well as hosts. The third committee should meet or talk with the top industrialists, businessmen of that particular district and request them to provide either from their CSR funds or otherwise also by in the form of ICUs, oxygen supplies, ventilators, etc. to these newly procured hotels, resorts, dharmshalas, lodges and hostels as per the requirement of the medical director or medical board of that hotel or that premises which is going to be managed by the private hospitals under the supervision of definitely the district hospital as well as the district collector or the deputy commissioner of the district. So those industrialists or the top rich people, the philanthropists will procure the equipments, medical equipments and furnish those medical equipments as early as possible in these particular premises. The next committee will meet with all the active NGOs, service clubs, heads like Lions, Rotary, JCs, etc. and ask them to raise the funds and to provide medicines as well as the food in those newly procured premises where the coronavirus patients will be treated, which I am sure with the persuasion of all the public representatives, public servants and from all the sector of society, definitely they all would like to come and help in that way. Basically, newly provided facilities will have almost everything, right from the premises, the beds, the medical equipments, the medical fraternity, the doctors and the nursing care, as well as the medicines and the food for them and food for their relatives. So basically, all the entire district will be having different hotels, resorts, lodges, dharmshalas, hostels in different parts of the district where the coronavirus patients can be treated, because it is very safe. This virus, after the 14 days, the virus effect is going to be negligible. So once this epidemic will be over, the resort or the hotel or everything have to kept 14 days without any function, and after that they can use their hotel, resort, lodge, hostel, dharmshala as usual. By this way, we can save many lives without disturbing the existing medical facilities available in our country, because as per the data, almost 25,000 people are dying every day due to the different diseases, whether it's cancer, tuberculosis, wants of organs, etc. So we have to save them also. After all, one life saved is as important as even 10 life saves. We are a democratic country. We are not a communist or any other country where we can want that people should die. No. But it has to be done collectively. We should not think that this is the responsibility of the ruling party or this is the responsibility of the bureaucrats or the medical fraternity. No, it's all our responsibility. We all, please mind it, we all have to come forward and to save our own countrymen. And this is only possible by doing community work. One thing, please keep yourself indoors as well as try to contribute in this way. Because here you are not paying to anybody, you are paying directly for the services to be provided to the patients. And I am sure that this is going to generate so much fund that we can proudly say that no one or very few people died because of coronavirus, because the entire country has come together to safeguard them. You can very well ask why I have not written this and send a mail or something to the politicians or the government authorities, etc., etc. No, I want that everyone should be involved. We all are one. There is no difference between caste, creed, religion, language, political differences, nothing. We all are Indians first. We all are one. We have to save our country. We have to save our Indians. We have to save the entire world. This is only possible if we will circulate this, we will see to it, and in case there are few things can be added or subtracted, that is the discretion that the high committee, which is comprising of the politicians or the bureaucrats, they can decide. Because after all, I am not a superhuman. I am just a person like you all. But I thought, why not I give these suggestions? If they like it, if any of the district like it, if they try to apply this, I am sure we can save many, many lives. That's all. And I be safe, be healthy, be happy. Thank you very much.